I'm a pretty active person. I really, enjoy going to the gym, and I enjoy traveling a lot with my daughter. I got an injury about a year ago. Had an injury in my shoulder. And that injury kind of progressively got worse. Got to the point to where I couldn't do some of the things I did before. I couldn't go to the gym. I couldn't pick up any objects over like about 5 pounds. It got progressively worse, so I couldn't even pick up my telephone. When you get shoulder surgery, when you get knee surgery, it's the recovery afterwards that can sometimes take anywhere from 4 weeks to like 8 months. It's both kind of debilitating and it's painful post-surgery. So a lot of people that I know that have gone through surgery, that's their biggest concern.
Heather's journey was very typical of most rotator cuff injuries. It came on out of nowhere and it slowly grew more and more to the point where she was very miserable just with daily activity. Surgery has downtime and recovery, so as part of Heather's process of trying to keep her out of the operating room, we tried physical therapy, anti-inflammatories, cortisone injections, and for a lot of people, these work really well at controlling their pain and avoiding the need for surgery. But a certain amount of people do not respond to those non-surgical treatments and they need surgery. In Heather's case, I explained to her that because of the size of the tear on her MRI and her inability to respond to non-surgical treatment, that fixing the rotator cuff with the Why Not anchors, Argo anchors, and the BioBrace would be the best thing for her to get her back to where she needs to be. Choosing the BioBrace is an easy choice for rotator cuff repair for me as an orthopedic surgeon. It has not only strength, but it has collagen that adds to the biologic healing of the rotator cuff tear. It gives us really good chances at getting that tendon to heal to the bone.
After I had a consultation with him, he gave me a lot of confidence that, you get this surgery, you'll be, pain-free, and you'll be able to travel. So I just finally made that decision and get back to normal life again. Being pain-free is a huge advantage. Just being able to kind of sit and relax at times and even sit down and watch a movie and be pain-free is definitely improved my mood and my ability to kind of, focus at work and not be distracted.
One of the things that as a orthopedic surgeon that I just find so rewarding is getting patients back to their lifestyles that they want to live and be pain-free. Having the BioBrace has really enhanced my ability to give them their lives back. They heal their tendon tears, they do the rehab, and they get better and they move on. And it's so rewarding to see patients be able to go back to sports, go back to playing tennis, skiing, or whatever they want to do. And the BioBrace helped me help them get there.
I can go actually exercise now. I'm doing some home remodeling. I'm putting in some new flooring. I'm able to actually do that again. I'm able to kind of go out to my friends. I was able to recover within 8 weeks to take, a 2-week vacation and enjoy it completely. Sometimes you have to make hard choices. I think it's just really important to understand that the healthcare professionals out there are there to make patients' lives better and make products that can make your life better, and I'm grateful for it.